Hi, my name is Diana Sandoval. This is my head to toe assessment for the spring 2026. Today's January 26, 2026. This is my patient Esteban. I've introduced myself and performed hand hygiene prior to beginning the recording. I'm going to scan my room. The walls, the floor, ceiling. These are my supplies. Okay. We're going to begin with the skin assessment. We're assessing the head, the face, the neck, the posterior chest, anterior chest, and abdomen. These areas were done prior to beginning the recording for patient privacy purposes, but we'll be assessing for skin integrity such as texture, moisture, edema, bruising, levi, any skin lesions, or any other skin concerns. We'll continue inspecting the head and the scalp. I'm looking for hair distribution, which is evenly distributed. It's coarse, it's a dark brown, and it's soft. There's no signs of infestations, depressions, masses, or tenderness, or nodules that we're concerned about. We're gonna go ahead and palpate the lymph nodes of the head and the neck. We'll begin with preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. There's no tenderness, masses, nodules, or any concerns noted. We're going to continue palpating the temporomandibular joint. Go ahead and open and close your mouth. I'm looking for crepitus, subluxation, or tenderness, which there's none noted. We're gonna assess cranial nerve number 5. Trigeminal, motor function first. Clench your jaw. I'm feeling the masseter muscle, making sure it's functional, and it is. Open it. Okay, perfect. We're gonna assess the sensory function of cranial number 5, trigeminal as well. Close your eyes. Let me know where I'm touching you.
Forehead, nose, right cheek, left cheek, chin.
Okay, perfect. Cranial nerve number 5 is intact. We're gonna assess cranial nerve number 7, facial. I'm gonna have you do a couple face expressions. I'm looking for symmetry. Smile, frown, pucker your lips, puff out your cheeks, and then raise your eyebrows. Okay, cranial nerve number 7 is intact because there is symmetry throughout. I'm gonna feel the temporal arteries. There are 2 plus bilaterally, no concerns there. We're gonna assess the ears. We're looking at the shape and position of the ears. They're normal shape for the patient and they're symmetrical bilaterally. I don't have any concerns there. I'm gonna palpate the pinna and the tragus on both sides for any tenderness or masses, which there's none noted. And I'm gonna look at the auditory canal and the tympanic membrane. Okay, auditory canal is clear, tympanic membrane is like pearly gray. We'll do the same on the other side. Okay, auditory canal is clear, tympanic membrane is a pearly gray, no concerns there. Okay, and now we're gonna be, and also the head is in midline position and normal cephalic size for the patient. I'm gonna assess some hearing tests. This is for testing the vestibulocochlear nerve, cranial nerve number 8. I'm gonna whisper a couple things and let me know what you hear.
1, 2, 3.
Okay, we'll do the same on the other side.
Apple green, yellow, purple.
Okay, perfect. I'm gonna do the word test to check for lateralization. Let me know if you hear it equally on both
Yes.
sides. Okay, we're gonna do the Rene test to test air conduction over bone conduction. I'm gonna place it behind your ear. Let me know when you stop hearing it and which one's louder. So mastoid bone.
I'm done.
And
I'm done hearing it.
okay, which one's louder?
Number 2.
We'll do this one on the other side.
I'm done hearing it. I'm done hearing it.
Which one's louder?
Number 2.
Okay, and so vestibulocochlear nerve is intact. I'm gonna look at the nose. The nose is straight mid-length position. So no concerns there. I'm gonna check for nasal patency and the olfactory nerve, cranial nerve number 1, and have you close your eyes and let me know what you smell.
Alcohol.
Okay, nasal patency is intact on both sides, and so is cranial nerve number 1, olfactory. I'm gonna look at the eyes. Go ahead and remove your glasses. I'm looking at the eyebrows, the eyelashes, and the palpebral fissures. I don't see any masses, discharge or concerns. And then I'm also gonna look at the sclera and the conjunctiva. Conjunctiva is nice and pink, and sclera is white, which is good. We're gonna assess optic nerve, which is cranial nerve number 2. We're gonna begin with peripheral vision. So go ahead and look at my nose. Cover one of your eyes. Tell me what you see.
1, 2, 3, 4, 2.
And then do the other side.
1, 2, 3, 1.
Okay, peripheral vision is intact. Now we're gonna do central vision. You can put your glasses on for this. Let me know the smallest line that you can read.
LTFPH.
Okay, 20/20 vision both eyes, and then cover one of your eyes.
LTFPH.
Okay, 20/20 vision of the left eye, cover the other eye.
LTFPH.
Okay, 20/20 vision. Cranial nerve number 2 is intact. We're also gonna test oculomotor cranial nerve number 3 for light responsiveness, making sure pupils are responsive and equal to light. So I'm gonna shine a bright light. Okay, pupils are responsive to light. They're round, they're about 4 millimeters, and then we're gonna test for accommodation and convergence. I'm gonna have you look at my pen light and then follow with your eyes only. Okay, accommodation and convergence is present, no concerns. We're gonna test cranial nerve 3, 4, and 6, oculomotor, trochlear, and abducens, by having him follow the pen light in the 6 visual fields of gaze and looking at the eye movement for, making sure the muscles are moving smoothly. Okay, cranial nerve 3, 4, and 6 are intact. Now we're gonna look at the red eye reflex, make sure it's present, and then we're also gonna look at the internal eye structures. Okay, let's straight ahead. Okay, red eye reflex is present, and there's no hemorrhages or any concerns. Optic nerve is intact. Okay, red eye reflex is present. No hemorrhaging, optic nerve is intact. All internal eye structures look good. Now we're gonna go ahead and look at the mouth, the lips, the teeth, the gums, the buccal mucosa, the palate, the under the tongue, posterior pharynx and tonsils. So I'm gonna have you open your mouth. Okay. No redness, lesions, or signs of concerns. All teeth are present. Tonsils are 1+, and then lift your tongue. Salivary glands are intact as well, no concerns. We're gonna test cranial nerve number 9 and 10, glossopharyngeal and vagus. We're gonna look for equal rise of the uvula and the soft palate with phonation. So go ahead and stick your tongue out and say ah. Good. And now we're gonna test cranial nerve number 12, hypoglossal. Go ahead and stick your tongue out and move it up, down, side to side. Tongue is mid-length position and is free of fasciculation. So cranial nerve number 12 is intact as well. We're gonna look at the throat, make sure the trachea is mid-length position, which it is. Now we're gonna palpate, still mid-length position, and we're gonna feel for the thyroid gland. So I'm gonna deviate the trachea and have you swallow, okay? Okay, and then do it again. Okay, thyroid gland is non-palpable, no masses, no concerns or nodules noted. We're gonna feel the carotid pulses on both sides. They are 2+ equally, and we're gonna listen for any bruits. With the bell of my stethoscope. And I hear none. Now we're gonna listen to the heart sounds. We'll begin with the right second intercostal space, aortic, left second intercostal space, pulmonic, and then third intercostal space, Earth's point, fourth intercostal space, tricuspid, and then fifth intercostal space, midclavicular line, mitral, and then this is the site for apical pulse. I'm gonna listen for a full minute. Okay, rate is 80, it's sinus rhythm, and I can hear S1 and S2, no extra heart sounds, murmurs or gallops, no concerns there. And then I'm also gonna identify the point of maximal intensity, which is present, no concerns there. And I will also listen with the bell on my stethoscope. Aortic, pulmonic, Earth's point, tricuspid, mitral. Good. I'm gonna have you lay down on the couch for me, please. And then we're gonna have you lift your upper torso about 30 to 45 degrees and extend your neck. I'm looking for any jugular vein distension or jugular vein pulsation on both sides. I see none, that is normal. Go ahead and lay flat. I'm also looking for any heaves or lifts in the upper chest. I don't see any. And then I'm gonna feel for any thrills over the 5 auscultation points. So aortic, pulmonic, Earth's point, tricuspid, mitral. And then I'm also gonna auscultate with my stethoscope. Begin with the diaphragm, aortic, pulmonic, Earth's point, tricuspid, mitral, and then the bell, aortic, pulmonic, Earth's point, tricuspid, mitral. And I'm gonna listen for any bruise in the aorta, iliac arteries, renal arteries, and femoral arteries. Bilaterally, I should say. So renal on the right side, renal on the left, iliac on the left, iliac on the right, femoral on the right, and femoral on the left. No bruise hurt, no concerns. And then I'm gonna auscultate the abdomen, but first I'm gonna look for contour and shape of the abdomen, which is round, and there's no asymmetry. Now listen, right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant, active vowel sounds in all quadrants. I'm gonna percuss in all the quadrants, and percuss over the liver, and then deep breath in and hold it, and then over the spleen. No concerns there. I'm gonna palpate. Oh, and I was percussing for tympany, dullness, and flatness, and then I'm gonna palpate for tenderness or masses, palpating for the spleen, the liver. Okay, no tenderness or masses noted. So I'm gonna have you sit up, and I'm gonna have you sit facing backwards. We're gonna check for CVA tenderness bilaterally. Let me know if there's any tenderness when I do this.
No.
Okay, now we're gonna look at the posterior chest. Look for any respiratory distress signs such as nasal flaring, retractions, tripod positioning, cyanosis, accessory muscle use, or any other respiratory concerns. I don't see any. And then I'm also looking for equal chest expansion and symmetry, which I can see, and I'm gonna palpate for chest expansion. Deep breath in. Okay, it is evenly on both sides. I'm gonna percuss over the lung fields in the intercostal spaces. Okay, resonance is noted throughout, which is normal. And I'm gonna go ahead and auscultate the lung fields. Deep breath in every time I touch you. Okay, and I'm gonna test for egophony. Every time I touch you, say E.
E, 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 E.
Okay, and now we're gonna test for bronchophony. We're gonna have you say 99 every time I touch you.
99, 99, 99, 99, 99, 99, 99.
Okay, no. And then we're gonna do whisper pectoroloquy. I'm gonna have you whisper 99 every time I touch you. no concerns there. I'm gonna palpate for tactile fremitus. Every time I touch you say 99.
99, 99, 99.
Okay, that is perfect. I'm gonna have you turn around. We're gonna auscultate the lung fields of the anterior side and palpate for equal chest expansion. Go ahead and deep breath in. And then say 99 every time I
99.
touch you.
99.
And we're palpating
99.
for tactile fremitus in the
99.
front. Now I can listen to the lung sounds. Deep breath in every time I touch you. Awesome. Okay, lung sounds are clear, no concerns there. We're gonna go ahead and move on to do motion of the hands and the fingers. We'll begin with the fingers flexion, extension, hyperextension, abduction, adduction, and then wrist flexion, extension, hyperextension, ulnar deviation, radial deviation, and then rotation. Full range of motion of the fingers and the wrist. And then we're gonna do elbows, flexion, extension, hyperextension, full range of motion of the elbows. And we're gonna do shoulders, flexion, extension, hyperextension, abduction, adduction, circumduction. Full range of motion of the shoulders. Now we're gonna assess for strength. Go ahead and grip my fingers as hard as you can. Good. 5 out of 5 strength. Put your elbows up. I'm gonna assess the biceps and the triceps. Don't let me push, don't let me pull. 5 out of 5 strength. And then now we're gonna assess the strength of the shoulder girdle. Put your arms out. And then don't let me push down. And then don't let me pull up. Perfect. We're gonna assess cranial nerve number 11. Accessory, shrug your shoulders against my resistance. Good. And now we're gonna do deep tendon reflexes. We're gonna assess a brachioradialis. Okay. And then the bicep, triceps. And then we'll do the same on the other side. Brachioradialis. Okay. Bicep. Tricep. Good. And then we're gonna do patellar both sides. Good. Other side. Good. Achilles. And then the other side. Good. And then Babinski. Okay, good. And we're gonna do, I forgot to do the fingers, just the thumb up position. And we might as well just do the cerebellar coordination. So I'll have you do finger to finger, back and forth, and then put your hands out and then flip back and forth. Good. And then I want you to touch your nose and then touch my finger. Okay, perfect. That is normal. And we're gonna do a vibratory sensation. So kind of put your arms out a little bit. Okay. Let me know if you feel
I
this.
feel it.
What about here?
I feel it.
And then what about here
I feel it.
and
I
here?
feel it.
Okay, perfect. Vibratory sensation is present. Go ahead and close your eyes and let me know when I'm touching you. I'm doing light touch.
Right arm, left arm, right leg, left leg.
Okay, perfect. That is normal. And I can't remember if I did grip strength, so thank you. And we're gonna do toes now. We're gonna do flexion, extension, hyperextension, abduction, adduction. And then we're gonna do ankles, plantar flexion, dorsiflexion, eversion, inversion, and then rotation. Okay, full range of motion of the toes and the ankle. And now we're gonna assess strength of the feet. So press like you're hitting the gas, pull towards your nose, and then now we're gonna do the knees, press against my hands, and pull towards you. And we're gonna do hips, go against my hands, and then pull to the inside. Okay, 5 out of 5 strength on the lower extremities, and there's no signs of edema, and no crepitus, no tenderness, redness on any of the joints. And then the dorsalis pedis pulses are 2+, the posttibialis are also 2+. Okay, I'll have you stand up. We're gonna do range of motion of the knee. We're gonna go flexion, extension, hyperextension. Other side, flexion, extension, hyperextension. And then hip, Flexion, extension, hyperextension, abduction, adduction, internal rotation, external rotation, circumduction. Same thing on the other side. Flexion, extension, hyperextension, abduction, adduction, internal rotation, external rotation, circumduction, full range of motion of the hips and the knees. Now we're going to do, says the back, looking for any tenderness on the spine, which I see none. I'm going to have you flex at the lumbar spine, looking for any scoliosis or deformities of the spine, which I see none. And then you can stand up. Now we're going to do extension, hyperextension, lateral, flex, rotate, good. And we're going to do cervical flexion, extension, hyperextension, lateral flexion, and then rotation. Full range of motion in both of those. I'm going to have you walk away from me and then walk back, heel to toe. Yeah.
What do you mean? Heel to toe?
Heel to toe. Okay, regular, okay, in tandem. And then I'm going to have you do the rumbar test. Close your eyes and keep your hands to your side. Okay, there's no swaying. That is normal. I'm going to have you hop on one foot and then the other. And that concludes my head to toe assessment.